because the goal is ultimately to get you a faster recovery, right, in the shortest period of time. And so what we actually do is a couple of things. First is that once you've made the decision to undergo surgery, we actually first try to make sure that you're, from a mechanical and physical point of view, in the best health you can. So we do something called Prehab, where we have you work with a physical therapist on a protocol that we created to make sure that your body mechanics are well. Because we know that the more optimized you are going into the surgery, the better you are afterwards. So the first thing we do is actually get you in a short program, perhaps 2 to 3 weeks, maybe four, where we do prehab and optimize you. Next, we have you visit our nutritionist. Our nutritionist, actually, what we learned now, of course, is that if you have bad nutrition, vitamins, minerals, bad gut health, that your recovery is slowed down. So we actually have you see our nutritionist, who spends some time making sure your protein is good, make sure your vitamins are good. Once we do that, then we get you to the operating room. In the operating room, and oh, sorry, one more thing. Before we do that, we spend extensive time explaining to you the process of surgery and doing education. And then once we get you to the operating room, the process is pretty straightforward, where the anesthesiologist will sit you up and do the spinal anesthesia. You can position yourself on the table in any way you want. And then I do a regional block. So what the novelty about awake spine surgery is that I use a medicine called Exparel, which is a slow release marking, and it lasts for 48 hours. So we actually do that as a block. And what that does is, because the medicine lasts for 48 hours, you actually don't feel much pain for 2 days after surgery. So I do that as well. And then we go ahead and do our surgery. Surgery takes about an hour and a half to do. After the surgery is done, the spinal anesthesia is wearing off. And then about 3 or 4 hours later, the nurse gets you to stand up, gets you to walk, make sure you can perform some basic functions, such that about 5, 6 hours after surgery, you're get ready to go home, get in the car, and all that. And then from there, we encourage you to continue walking. We actually call you the night of surgery, we call you the day after surgery and thereafter, and make sure that we get you moving and walking, because we don't want you laying in bed. After we see you for the incision, about a week later, 2 weeks later, we get you started with the physical therapist who knows our protocol. And again, our goal is to optimize your outcome, not just in the operating room, but overall. So that's why we make sure the physical therapist is following you both before and after, the nutrition is following you both before and after, and of course, we're following you as by what we believe is that by putting this whole process together, less invasive surgery, avoiding general anesthesia, prehab, nutrition, education, that we're achieving the best outcome we can for someone who undergoes spine surgery.